Hello everybody and welcome. We're just waiting for a few more participants to join us before we start. We'll be with you in just a minute. Thank you. Good morning. Thank you for joining us today. It gives me great pleasure to welcome you all from across the globe to the launch of the growing value of XR in healthcare in the United Kingdom. The report has come about following a fabled tweet from a VR enthusiast, Ben Williams of Care City, to the BBC and the heads of the NHS, looking to share the knowledge that the BBC had accrued in setting up its VR lab with the NHS. It was at this time that we realised that healthcare didn't need another showcase of the brilliance of medical XR or another asset or product. In order for immersive healthcare to grow, flourish, and make an impact on the lives of patients and clinicians, it needed a strategy or a commonly held set of ideals, values, collaborations, and a direction of travel. So today, ladies and gentlemen, this is what we're going to share with you in the form of our and your white paper. The report also wouldn't have existed without the input of our steering group, support of the XR community, and the fabulous hard work of Sarah Tico and Fiona Kilkelly. A lot of faith has been put into Sarah, Fiona, and I in making this report a reality. We spent a lot of time talking to numerous organisations, seeking funding to make the report happen, but it wasn't a difficult task, as there was a real groundswell of support. This report simply had to happen. With the fabulous support of the community today, it's here and we're able to finally share it with you. It's been an interdisciplinary approach to creating the report, with contributors, authors, funders and supporters from academia, healthcare and the tech sector, all coming together to make this a reality. We're hoping in coming weeks that we'll also secure ministerial support for the report to add to that of Health Education England, the NHS and the UK Research and Innovation, or UKRI. The UK's National Health Service is seen as the gold standard for healthcare internationally. The quality of care, the clinical standards, advanced technology and precision medicine are all possible within XR healthcare initiatives. And this becomes a global blueprint when it's deployed and scaled in the NHS. This report gives us a clear vision to trial, validate, scale, realise benefits, and get XR into the hands of patients and practitioners. Finally, I'd like to mention the support of Audience of the Future, Health Education England, Rescape, and UKRI, and the UK Safety Initiative, whose funders who funded this report and have made this report happen. We're going to hear from these contributors in just a moment. Unfortunately, XRSI couldn't be with us this morning, so a special mention goes out to them. XRSI is a global organisation developing standards for the safe and inclusive adoption of XR ecosystems. They're building the first privacy and safety framework for XR, and this report hints at several privacy, safety and regulatory aspects that they will include in the framework. A number of contributors to the report are members of the XRSI Medical Advisory Council, and we are very thankful that they contributed and made the report a reality. Okay, so now we're going to hear a few words from some of the people that have made the report a reality today. Firstly, Mike Craven from Audience of the Future, Mindtech and Nottingham University. Mike.
Good morning. I'm an academic researcher in the NIHR MindTech MedTech Cooperative, which is a national centre based at the University of Nottingham in the Institute of Mental Health. We are developing and evaluating clinical interventions in mental health and dementia. Supported by the National Institute for Health Research through its Invention for Innovation programme, we're currently part of a multi-centre trial in the National Health Service called Game Change, which has developed a step cognitive therapy for people living with schizophrenia. It uses a friendly avatar therapist in a set of virtual environments, such as shop, cafe, or doctor's waiting room, to train patients in techniques to tackle social anxiety and worries. So with my colleague, Aisling Bergin, who is on the panel later, I'm really pleased to be part of this report. We wrote the clinical mental health and health economic sections together. It's been very interesting to learn more about application areas outside of our usual remit. It is clear some applications of extended reality are already in the NHS, but need to be better embedded. We are keen to be involved in the research that will prove its benefits in different settings so that the best solutions are translated and scaled. I hope you enjoy reading the report. Thank you.
Thank you, Mike. And over to Neil from Health Education England. Neil Ralph.
Thank you, Ross. So good morning, everybody. So my name is, as Ross mentioned, Neil Ralph, and I'm Head of Technology Enhanced Learning at Health Education England. I am really pleased that we were able to support the development of this white paper, and I am really excited as to the impact that it's going to make, and I'm really excited for the future and the great benefit that the continued evolution of the of XR and its application into healthcare. We see that there is already a very important role that XR is delivering in terms of education and training of our healthcare workforce, and we see that that role is going to continue to grow and expand, and that XR is going to provide a really important will play a really important role in the way that we continue to train and educate within the NHS. So I'm incredibly pleased to be here today. So thank you very much, and well done, team, for developing the paper and getting to the point of being able to launch.
Brilliant. Cheers, Neil. Thank you very much. I'd like to introduce you to Matt Wordley from Rescape.
Hi, thank you, Ross. So good morning. So my name is Matt Wordley. I'm the Chief Exec of Rescape. So for those who don't know us, for the last few years, the team at the Rescape have been banging on the door of the NHS care homes and hospices, spreading the word about the positive impact that VR can make on pain and anxiety to both patients and staff. We've learned that the adoption and acceptance of a new technology into healthcare takes time, and it also takes strong evidence. And this report definitely further cements the evidence that XR can make in many places across healthcare and bring real value to individuals and also the system around them. For us, this report has not just been the ability to demonstrate where our medical device Dr. VR can help both adults and children in pain and anxiety reduction, and our iteration Dr. VR Frontline can help NHS staff deal with stress. But it's also been great because it's really brought together the NHS academia industry under a shared goal of bringing the value of immersive technologies to mainstream healthcare. As this report has been pulled together in the last few months, we built some really good relationships that are focused on overcoming some of the challenges of adoption and about where XR can be deployed today at scale for impact, but also developed for the tomorrow for the future opportunities. So anyway, we're looking forward to lots of exciting conversations and collaborations going forward into the future and seeing adoption at scale. Thank you.
Thank you very much, Matt. And last but in no means least, Andrew Chitty from UKRI.
Thanks, Ross. So I'm Andrew Chitty. I'm Challenge Director at Audience of the Future. And what we've been doing for the last 3 years is trying to achieve a step change by investing in the creative industry's use, adoption, and their capabilities in VR and AR. So This is a fascinating report because, as we've seen in Audience of the Future, the engagement between the creative sector and healthcare is getting stronger. And I'd actually recommend this report to anybody who has an interest in XR, whether they know a great deal about healthcare or not. Because when we look at the challenges facing us as a society and the kind of missions, if you like, because that's the current language of where we should invest in research and innovation, I think some of the most interesting of those missions are where you need to bring together different disciplines to solve them. And particularly from our point of view, where you need to bring our world-class creative industries to work with other sectors, be it solving net zero in terms of bringing design expertise, or here with the creative industries and creative technology working with healthcare. So I think the report shows the growing importance of XR in health through a selection of brilliant case studies and some ideas about how we take this forward. But I think it does much more than that. I think it's a big step change for the way we think about this interface around XR in health. And most importantly, I think it builds a significant case for large scale investment. And that's what we need in the future. So well done to everybody who's produced it. It's an amazing report. Thank you.
Thank you very much, Andrew. That's really, really helpful. And apologies, Andrew's from the Audience of the Future, not UKRI. That's my bad. Next slide, please. We'd just like to, before we move on, to talk to you about some of the report findings and the recommendations. Just like to acknowledge the organisations on the screen that have all contributed to the chapters throughout the report that you're about to see. Okay, over to Sarah and Fiona.
Hi there, everyone. My name's Sarah Tico. I'm one of the authors of the report, and I'm just going to start by giving a bit of an overview of the research that we've been undertaking that you'll be able to read in the full document. So there's a huge range of applications of VR in healthcare. I think in some early research we found there was at least over 20 different applications, and I think it was quite a challenge to cover them all. And so what we really did from the beginning is look at what are the core areas of application that are relevant to the needs of the UK here at the moment as well. And it's interesting as well seeing those people here today and representation of people in the audience. And when people were signing up to the event, we were asking what areas are you working in as well. And it's quite interesting to see the diversity of work that's underway. But I think that what's so exciting about this technology is that it has this ability to be used in such a range of environments and to support people in such diverse ways. The fact that we can use XR to predict the onset of new conditions, that it could perhaps prevent the onset of other ones as well, how it can be used as an educational and therapeutic tool that can be used at home or in clinic as well, and really engage people in quite a playful and participatory way as well. There's a really fantastic quote from Brennan Spiegel, who's based at Cedars-Sinai University, who I think summarises this really well and says that we can transform our minds drastically and immediately long after the headset is removed. And when used in the right way with the right people at the right time, VR brings wonder and beauty to mankind. And if nothing else, it offers joy. And joy is good, and we should leverage that like crazy. So I'm just going to give a little bit of an overview of some of the key applications and some of the findings that we've discovered, and then I'll pass it over to Fiona to share some more about the recommendations. So each of the key applications have been covered by experts in the industry. So we've got a section on clinical mental health and the varieties of ways that it's used in clinical settings, notably in the applications of things like post-traumatic stress disorder, phobias and social anxiety disorders. Examples like Game Change, that was a collaboration between Oxford VR, the University of Oxford, the Royal Society, a range of charities and organisations as well, including the Royal College of Arts and the McPin Foundation. Other examples include the applications of VR in mental well-being. So one of our case studies is by Rescape, who are using VR to support patients, to support healthcare workers during the COVID outbreak and managing stress and anxiety in those situations as well. or how VR is used as social prescribing to reach at-risk patients at home that perhaps aren't able to leave the house. And I think there's some really interesting opportunities here to collaborate with the creative and game sector and actually use existing entertainment-based experiences or work with those creators to make a whole range of experiences that can be used as a tool for preventative care as well. VR has been used extensively in pain management as well, and I think these opportunities are really exciting in how it can be used to distract patients from acute and primary pain symptoms. Patients like Kay Smith has been a wonderful advocate for the use of VR in managing pain at home. And we're seeing increasingly interest from researchers like Sheila Popper, who's based at Prospect House Hospice, that has actually been collaborating with David Attenborough to create a VR tool for pain management for patients in palliative care settings as well. There's a range of applications of VR and physiotherapy and rehabilitation, from prescribing VR headsets at home for people with for pulmonary rehab to the work of Ivor Phelan, who will share later on as well, about how you can use games and exercise as a way to increase patient participation and enjoyment and motivate them to continue to engage in those therapies as well. And of course, the opportunities in workforce training as well. And we've been working closely with Health Education England as well on the work that they've already been doing in deploying VR and AR in a range of settings as well, from being able to give medical patients, students, the opportunity to visit places that they couldn't do otherwise, to practicing certain surgical skills, or even being able to visualize different scans and x-rays as well from remote settings. And then finally, patient-focused education as well, and really putting the humanity back into how we train doctors and nurses, but also how we support patients in being able to reduce that anxiety before a treatment as well. So being able to visualize what the hospital might look like before you go, or showing the world through a patient's eyes as well. And there's some really interesting work being undertaken at Torbay and South Devon NHS Trust as well. And a really large part of this report really looks at the health economics of this as well. And one of the biggest drivers within the NHS is looking for how we can create value for money. We worked closely with Mike and Ashlyn from Nottingham University in Mindtech to develop the health economics of XR and really emphasise its potential to support healthcare and deliver effective outcomes in the most cost-effective way. And being able to look at things like how VR can be used as a distraction tool for small surgical procedures, and reducing that need to reschedule appointments and the possible cost savings that are available there, to how effective it is in being able to improve overall surgical performance as well. But I urge you to really have a look at the report, and we'd be really interested in your thoughts in the sort of research and findings that we've been gathering. Fiona, over to you.
Hi everyone. My name's Fiona Kilkelly and I'm one of the authors of the report, and I'm going to quickly talk you through the recommendations. We've proposed 3 key recommendations in this report, and at the core of each recommendation is a cross-sector interdisciplinary approach to collaboration, which is open, inclusive and diverse by nature, and builds on the funding mechanisms, partnerships and best practice and expertise currently supporting XR in healthcare across the UK today. So recommendation 1 focuses on landscape mapping, which is a really critical next step to this report. We need to dig deeper and we need to find out more about the companies, researchers, clinicians who are innovating in this space now, who they are, where are they in the UK, what areas of new research are being undertaken, if it's a business, information on what markets they operate in, company size, turnover, expected growth, and so on. And this information will not only inform the development of the Centres of Excellence I'll talk about in recommendation 2, but it will also ensure we've got the right people around the table and the right people are engaged in the creation and implementation of these recommendations going forward. And also it'll really help identify the size, makeup and potential of the XR and healthcare sector market, and we can then start to track its growth into the future. So recommendation 2 proposes the creation of an end-to-end development pipeline for new XR healthcare solutions that enables a clearer pathway from concept to development to market. The pipeline brings together researchers, games, creative and digital companies, XR expertise, clinicians with patient input, and it connects them to the funding and support they need to develop clinically robust, engaging, marketable solutions. And the Centres of Excellence would stem from existing expertise in 5 key areas covered in this report: physiotherapy and rehabilitation, mental health and well-being, pain management, healthcare professional training, and patient education. So this pipeline is embedded with the Centre of Excellence that's going to focus on these 5 areas. So it focuses on collaborative R&D and knowledge exchange and the facilitation of new innovation and early stage R&D and funding initiatives and co-innovation programs to enable collaboration between XR technologists, platforms, creators, healthcare professionals, and other sectors. It looks at playbooks and global digital exemplars, which are developing resources to help understand the capabilities of the technology and how to deliver these more quickly and cost effectively within the NHS than there has been to date. Then we move on to testing, scaling, and product development. And this focuses on how to test high value projects to pilot or prototype stage, leading to scalable and market ready solutions supported by a test bed to trials approach. And then we need to also look at regulation and quality assurance, and informing clinical and quality assurance procedures for the UK sector are in line with regulatory guidelines. And then we also look at procurement frameworks and developing a clear process to procure XR experiences into healthcare settings. And lastly, at the end of that pipeline, we look at distribution, exploring virtual pharmacies and new models of digital patient support and interventions, and a national platform for the secure distribution of health XR and healthcare solutions, simplifying purchasing options for healthcare providers. And then recommendation 3 looks at building a new cross-sector alliance and network by bringing people from across this pipeline together and creating an opportunity to share ideas, best practice, connect research and immersive tech expertise together, and essentially creating a new way of working together to develop a thriving and sustainable XR and healthcare sector in the UK, which has equality, diversity and inclusion at the very heart of its approach. So on a practical level, we'd like to invite all of you joining us here today to think about and explore ways which you can all come on board from your organisations, the companies that you represent, to help get involved and help collectively to further develop these recommendations and ensure that, as Andrew mentioned earlier, a step change is needed, that we all start to work together to create a thriving XR and healthcare sector today. So Ross and the team and in the chat will point you to ways to stay in touch and keep informed of developments going forward. Now I'd like to hand you over to Ivan Phelan from Sheffield Hallam University, who's going to give us an overview of his research in pain and rehabilitation and look at the transition of research into the healthcare settings and environments. Thank you. Over to you, Ivan.
Cheers. Hi, my name is Ivan Phelan. I'm a researcher at Sheffield Hallam University. And today I'd like to just give a bit of an overview of some of the work we've been doing that's included in this report. So we do a lot of things around rehab, pain distraction and training. But for today, I kind of just want to focus on one of those, which I think incorporates pain as well as rehabilitation in the same system. So for patients who suffer upper limb pain from like surgery or an accident, they have to go through a lot of rehab with low engagement, a lot of pain, but primarily they're just not doing their exercises at home and just not engaging. So we wanted to look at developing a system that could allow, for more kind of fun, engaging rehab that's kind of getting them to do what they need to do without the pain as well, obviously. So first thing we did was we got in contact with the physiotherapists, the occupational therapists, patients. We got game developers and academics together and trying to see what was required, what was the unmet need and how do we actually address it, the best that we could. So out of these workshops and observations, we started identifying different things, such as the movements that are required, such as above the head, behind the back. And we kind of thought, that looks like archery. They're reaching back to get an arrow from a quiver. So we started making prototypes to do kind of an archery game where you're getting these big movements of firing a bow and arrow. So we thought, like, the physio touch, those big stretches were all going to help towards their rehab. But another set of movements they showed was kind of what they call a tiger claw, and it looked like they were trying to climb a tower. So we thought maybe if we just made a climbing game where they're actually actively trying to climb a tower. And so we created this another scene where this kind of exciting fantasy tower where they have to climb up. And when we tried it with patients, they found this very exciting and very realistic. So after that, we did a trial with Sheffield Children's Hospital, which this video gives a bit of an idea how that went.
Right back.
Most of our kids have quite a long-term condition that they need to carry on doing their exercises for sometimes several years.
So remember to keep that one held, so a tight grip on the one on your right.
And they're doing the same things day in, day out. It gets really boring, no one wants to do it. Sometimes it's painful. It's just not really fun. They want to be out playing and doing things with their friends.
It's kind of a bit more playing than exercising, even though you are still doing your exercises. Like, it's fun as well. Oh gosh, that's
Do you need a break or anything like that? Is your arm tired or?
No, it's fine.
She didn't find it easy, whereas before she would have given things up very easily, but she wanted to keep going. She wanted to pop another balloon.
Yes, got it.
And she wanted to reach that next thing, but she's just been an absolute trooper. She just has a smile on her face every day, so it kind of encourages me to be positive.
There we go.
We've had kids come in that can only get their arms up to here, and then they come in straight away and they're picking the arrows up and getting full range of movement and not even noticing. And then when we interview them after, they said that they didn't even notice any pain. So it's been a big shock to me how well actually it has worked to do what we needed it to do.
So yeah, from that trial we had some really good results. The gonometer readings were all improved. The patients enjoyed it. They're actively wanting to do more of it. So from there, we've now done some home trials, and we're starting to get back some data on that. That's been quite positive as well, where they're rushing home to do their rehab, and the parents have found that very reassuring that they're not trying to, argue with them to do their exercises. But finally, I'd just like to say that we're delighted to be able to contribute to this report. Alongside some incredible case studies that are truly inspirational. And I do think it kind of goes to show how much this area has grown in the last few years, that the NHS has taken XR in healthcare so seriously now. But also it feels like there's no better time to be starting to explore this rich space. And personally, if I had something like this report a couple of years ago, I think it would help identify an awful lot of red flags for us. But also not just that, but realize that there's a thriving community out there that I don't think I really realized it was actually there this whole time. But yeah, thanks for listening, and I look forward to hearing the discourse around this report.
Thank you ever so much, Ivan. And just so you're aware, a lot of really positive feedback's coming in on your presentation in the chat. So thank you very much for that. As ever, I said at the beginning that we don't want to kind of wheel out somebody that's a great. We don't want to bring people out just to kind of showcase their work and then take it back. And I think for me, Ivan is a perfect example of somebody that we really want to showcase and see the value of what we're doing. And I really welcome the fact that, hopefully, Ivan, for you and everyone else that works in healthcare, this can be the roadmap that gets us to a place where actually the work that you do can be showcased, but can be scaled, and it can be used elsewhere as well. So thank you very much.
Thanks very much. 100% agree. Thanks.
Okay, so we're going to move on to a panel discussion. with some of the people that have been involved in the report. So I'd like to introduce the audience to Payal Gataneka from Torbay and South Devon NHS Trust, Rod Joyce from NHSX, Neil Ralph from Health Education England, and Ashlyn Bergen from Mindtech. They all are welcome. So, and can I also ask the audience if you're able to put any questions you've got for the panel into the Q&A section. We'll be keeping an eye on that throughout this section of the report launch today, and trying to get the questions to the panel. But if I could start off with chair's privilege and ask for Payal first, what are the current challenges that you're seeing in terms of deploying XR in a hospital setting?
Okay, thanks a lot, Ross, and thank you for letting me be part of this panel and talk about our experience at Torbay. So in terms of challenges, there are quite a few, and you only learn these while you go through the process of implementing. So talking about challenges, one of them is that XR headsets are quite expensive. So to convince your healthcare administration to invest in the XR program can be difficult. And to do that, I think some of the things that you can do to solve this problem is you could either collaborate with some academic partners and see if you can apply for some kind of a funding to purchase new headsets. Other things you can do is that because there's a lack of awareness of what XR headsets are. I mean, people are aware of what it looks like, but they have probably had a bad experience in the past. Maybe they experienced motion sickness, so they may already have some biased views towards it. And what you could do to solve this is you could, first of all, I think you should dip into the literature and look at what people are doing currently to use those case studies. And most importantly, when you're trying to convince hospital administrators, you really need to find out some cases where they have done cost-benefit analysis, cost-effectiveness analysis. So as long as you have all these things together, I think the one thing you could do is put it together in a proposal that people can understand easily. And then they may be able to understand more about the benefits of XR and how it can be used to solve problems. Another issue is, again, with biased views. I feel XR itself is quite a small field, and there are views from like minorities, female perspectives that I personally feel are missing in the XR environment. So try to focus more on getting more inputs from different patient groups, different healthcare professionals from different backgrounds, and then use those insights because they may know things that you may not be aware of. And when you're implementing a program, I think to make sure that it's successful in the long term, it is important to involve everyone's views. And the final challenge that I have personally felt as a researcher at Torbay is that everyone has brilliant ideas about XR. So when you mention XR, it's quite an exciting topic and everybody has something to say about it and how they can use XR to solve some problem. But because XR teams are generally small, you need to make sure that when you take on projects, that are actually solvable, where that can actually, where XR can actually be used. So don't try to take on too much in the beginning. If you start small and then try to convert those projects into pilot studies, which could then add to the research and help other global healthcare providers as well. So those are some of the challenges that I've come across. And
brilliant.
Yeah.
Thank you, Payal. And that very much resonates in terms of our one of the recommendations that we do have that pipeline, that there is the seed of an idea, that the academics, clinicians, the tech sector come together and think about that. Start with a small idea, and then we help it grow. So that's really helpful to know that we're kind of looking at the right lines in terms of how we develop. I'm interested in one of the things you said at the beginning, and I think I'd like to bring in Neil to respond to it, was about getting devices and headsets and the kit into people's hands. I know that Neil, HE, you've been doing some fantastic work in that area. Can you respond to that at all?
I mean, I can. I mean, I can certainly say I think that what you're describing there, Payal, is a common hurdle that and you have all been very creative in Torbay as to how you've taken different approaches to try and overcome just that sort of hurdle. I think that there needs to be, and this is something I'm keen to through HE that we continue to do some work on. We need to explore how we can support colleagues around the NHS to overcome hurdles of procurement, and there's a number of things that we need to try to do to make that happen. One of the things we need to do is make sure that there's solid evidence base in applications. Apparently, you're talking about starting small, piloting, evaluation. And evaluation from the beginning, building that into things is really, really critical. So that helps us establish business cases that are likely to support accessing money. And the other things that we need to be looking at, I think, is how we combine and collaborate across things like across regional bases. So, you know, being able to, there is always money around to invest in where there's a really good use case and application that's going to drive some benefits. But sometimes that money is best accessed when it is available to be delivering solutions at scale beyond the boundaries of an organization. And then the other thing to do is to make sure that you're connected up, again, thinking around either nationally or regionally with the range of different kind of organizational bodies that have a part to play in the innovation of technology into healthcare or the application of effective new techniques, whether that's in delivering different ways of delivering, working with patients, or in my world into how we educate and train. So I'm not going to give you one clear solution, but as you can see, I'm pointing people in the direction of connecting up regionally and working with people and making sure that you build a valuation in, so you have a solid business case if you're ever knocking on somebody's door to try and get some money.
I'm just going to ask you a further question on that, Neil. In terms of, because you know, in health education in England, you've done some fantastic work in bringing experts from all over the world together. You know, considering how you can get kit into the hands of clinicians so that they can not only test and grow ideas, but also learn from one another. You know, what good examples of best practice have you seen internationally from bringing those groups together, and what do you think what do you think we can learn in the UK from the partners that you work with?
Thanks, Ross. I mean, there are some fabulous examples out there around the world where there's some really efficacious applications of vector immersive technologies into this field. And I think there are some people on the call here that represent some of the organizations that are paving the way on some of that work. We've seen, particularly, which is typical in the world of technology, we see the often in America that they've made some greater headway in being able to access solutions that provide some really high fidelity simulated experiences of within healthcare that create fabulous learning opportunities. So we're seeing there being a shift towards taking a lot of learning experiences from the real world setting, particularly simulated learning within a real world setting, and that now being driven via XR, driven via often CGI, but equally 360 video immersive experiences. We're seeing that applied in some great sort of use case areas, such as around how we train and educate our nurses. That's already very much in play in this country too. Some of the groups, some of the universities are really making some massive headway in this, UCL, Coventry, to name a few. But we're seeing them really pushing the boundaries, but we're seeing this at scale in some of the big hospitals in America. Some of the work coming out of Stanford's worth looking at as well. particularly in terms of how you can really engage and use immersive tech for learning. Ross, I'm seeing that we're on the forefront of some really exciting things in this space, and there are a few things that are quite key for me that are coming downstream from that continued acceleration of the innovation curve. Our ability now to bring massive computational power from the cloud is going to be game changing. So we're seeing organizations like Alderhay, hospitals like Alderhay, using being able to render really high definition graphics into the immersive space, and to be able to work with clinicians on looking at how, for instance, you might plan to be able to operate on a child's heart on some very complex surgery, or how you educate and train around that. And the other thing I'm really excited about, well, there's a couple of other things. We're seeing some great innovation in haptic feedback now. That's, I think, lots driven by the gaming industry, trying to really make headway in terms of that expanding the gaming sector with immersive experiences. But that's going to make some massive gains for us in how we support our healthcare workforce when it needs to have some sort of tactile feedback within that immersive experience. And we're seeing lots of groups starting to play with that, and that's across the spectrum. I'm going to bring up our often forgotten about contingent of workforce in our dental workforce who are doing a lot around haptics. How do you train people at scale to be really good at doing some of the complex work that they need to do on people's teeth? Lots coming out of dentistry on that. And the final thing, while I've got the virtual floor, Ross, is I think it's going to be really exciting, is the ability to collaborate more effectively in real time together in that immersive space. And I'm seeing some great innovation coming out from software companies that are going to increasingly empower us to work together from anywhere around the world, and to collaborate together within that immersed context. Very exciting stuff coming, and it's going to be a game changer for us, I think.
Brilliant. Thank you, Neil. That's really helpful insight into the future and also the present. I'd like to ask Ashlyn the question. So Ashlyn and Mike have been working with us on the report in terms of health economics. And I'm wondering, Ashlyn, whether we can ask where you've seen examples of XR already demonstrating benefits into the healthcare arena.
Yeah, thanks. So thinking about, I guess, sustainability and where we're at the moment, and building on what Neil and Payal have said, it's really important to consider that there are different perspectives in this area. So for commissioners and providers, there are national targets that need to be met by the NHS, and that's sort of things like outcomes and waiting times. Then there are local priorities that have been set locally and need to be met there. And so there are really difficult choices to be made about how to maximize the benefit from the resources that they have access to. And this is far more complicated than just what is cheapest, because you need to look at effectiveness as well. So usually from a health economic perspective, we would look at QALYs, which are quality adjusted life years, because that lets us use a measure of quality of life across several outcomes, different interventions and conditions. But unfortunately, there's not really enough research yet in the UK using those. So instead, if you look at the NHS, and they've identified sort of 10 different areas where they want to tackle efficiencies. And what we've identified within the work that we've done is that there are about 5 of these areas where XR has the potential to support those efficiencies. Those are covered by reducing costs, improving outcomes, and increasing access. So some of the key areas that can help are in reducing demand for elective care, which is more important than ever, with 4.5 million currently on the waiting list, and inappropriate hospitalizations as described in the podiatry use case. Within mental health particularly, it has the potential to help services meet demand through remote or automated delivery, as in the case of the project that we work on, Game Change, and in other areas such as pulmonary rehabilitation, as in PR and VR, which is described in the report. It can reduce unnecessary risk, say for instance in the case of virtual ward rounds at Imperial. It has the potential to improve productivity through improving staff well-being and clinical quality and efficiency in areas such as surgical training. In the report, we highlighted several examples of these existing XR interventions that demonstrate the potential to deliver very positive cost savings alongside improved outcomes.
Thank you. That's really helpful. And I think it's, if we're able to really clearly elicit where the benefits are in the system, then XR kind of sells itself. And I think it's interesting that you highlighted the pulmonary rehabilitation piece of work that Dr. Farhan Amin is championing, because one of the key things in terms of our recommendations is that at the end, when we have a product, when it's been tested, when it's been clinically verified, when it's kind of been sold into the NHS and it's being used with patients, then we need to get it at the appropriate space for clinicians to be able to, in inverted commas, prescribe it. And I'm really heartened to see, that piece of work that you highlight, that the pulmonary rehabilitation in virtual reality is being prescribed in the same way as you would prescribe medication. So yeah, that's really helpful. Thank you very much, Aisling. I'd like to bring in Rod Joyce from NHSX. Rod, hearing all of this about the report and also understanding how the NHSX has championed AI and RPA in recent years. Where for you does immersive healthcare sit, and how might we replicate the success that we've seen in those areas?
Thanks, Ross. Yeah, it's fascinating to hear everything that everyone said so far, and how sort of developed there are, how developed the pockets of excellence really are across the country. And I think if you look at RPA, you look at AI, you look at some of the remote monitoring work we've done over the last 6 months and longer, there's huge synergies with what you're trying to do within XR, and obviously what's been done around the other spaces in health and care. So I think the RPA approach of building those centres of excellence, building those exemplars and maximising the opportunity of those who are invested in the tech, I think provides a real showcase and an opportunity to demonstrate what is working. Now, yes, the exemplars are really good, but we need to make sure that we are making sure that we raise the bar across the board. So being able to share all those learnings from that centre, those centres of excellence, and bring people, who want to invest, but don't have the capacity or capability at the moment to be able to come on board, I think is really important. We sort of level up in that sense as well. But it's, sharing that learning is kind of really important. And what we're trying to do at X is build a national infrastructure for some of these things. So not be too prescriptive as to what regions and ICSs can do in the future, but actually say, if you want to do this, if you really want to drive this forward, we're looking at some of the standards, some of the, as people have talked about, the efficacy and the evidence frameworks, the data standards, the content standards, the evidence standards, those things that actually are common across the country and across the world. We need to think far broader as well. We not want to reinvent things just for our own home market. But then how do we, what is our role in that, and what does the system need from us to be able to accelerate the use of all digital health tech? And obviously XR is a very key part of that. I think the AI lab, again, is really interesting. So, the lab itself really focuses on identifying some of the best technologies and working with some of the biggest partners in that space. But the award gives the ability to then provide, again, the infrastructure around it. So it gives it a real, provides a real focus point, nationally and internationally for AI technologies and machine learning technologies. So people know where to go. They know where to get the best advice, guidance, resources, toolkits, etc. And I think if XR can learn something from that, I think it's to be able to really give it that focus that, there's a role for the centre to play, there's a role for localities, there's a role for partners and commercial organisations to play, but come together. And I think when you're thinking about those boundaries, I think it's important that we, the evidence of what's happened with arm's length bodies during COVID is that the barriers between so many of them are broken down. You know, I think just the, you know, the number of logos you put up on the screen at the beginning, you know, I think we are working far more collaboratively. We understand the opportunity that Innovate UK bring, that MHRA bring, that NICE bring with evidence standards, that X can bring, that NHS Digital can bring, and, you know, the wider ecosystem and partners around it. You know, together we can tackle this and we can do things. But again, it's a matter of saying, and I think someone said in the chat, you know, the industry also needs to define the standards. The industry also needs to define the efficacy requirements and the approach of what we're trying to do. This shouldn't be a thing we're trying to do in the centre and prescribe it out. But then at the same time, you know, I think some of the stuff we've done with DTAC around some standards, you know, how can we expand that to cover new areas like XR? How do we work again with NICE to develop the evidence efficacy standards to be able to say, okay, well, we're not assessing these things, we're just providing the framework and the structure to be able to say this is impactful. And again, I don't know, sorry, who said it, but there was, you know, there's something around realizing short-term benefits of time back to care, or keeping people out of, you know, care settings with unplanned and then unnecessary visits. You know, the elective care agenda is really important, but let's start understanding what we need to do now to provide the long-term benefits. You know, what impact have you had on patients' lives who have a mental health issue over a period of 5 years, 10 years, 15 years? You know, I think that's really, really important. We start collecting a lot of that data now to be able to understand what the long-term impact is, both to patients and to the NHS as a whole in being able to deliver that. So yeah, there's a huge amount we can learn. I think XR, this report really sets out really clearly the recommendations to be able to say we're headed in the right direction. And, you know, X is, you know, really happy to support, you know, the approach that you're taking on this.
Thank you, Rod. We've had a couple of questions in from the audience. One is around international collaboration, and in your kind of position within NHSX and kind of looking out to the horizon, do you see many opportunities for us in the UK? Because obviously this is a UK focused report, but do you see opportunities for us to collaborate internationally, and if so, how?
Again, not least on standards. You know, I think that's something that I think if we come together and we say, look, these are the baseline requirements for what XR looks like across the system, I think those standards will be very, very similar across the world, particularly in some of the people who have really developed that. There's a lot to learn about what other people have done. As we said right at the beginning, I think Payal mentioned that, you know, the majority of suppliers in this market are international suppliers. So I think there's a huge amount that we can do to actually say, hang on, you know, health and care is a significant focus for some of these big suppliers. And we do have some of those big relationships, and we're working with some of those suppliers right now to understand what it looks like. And one of the things we've put together and hopefully be launching very soon is our partnership award that we're trying to take to the market to say, look, you know, there's some really good examples of what you can do out there, but there is some seed funding needed in some cases, like the AI award, to be able to say, let's look at that novel technology. Let's look at that established technology and how it needs to be scaled. What evidence can this prove? How do we scale this faster? And the partnership award is there to really, really try and support this sort of technology as well. So the work that I do as part of the CDO team is to be able to look at how we scale at the moment remote monitoring solutions to help people manage their health and care at home or in the community. And I think it's a very clear step forward to be able to say, well, okay, what is the next technology or the next area of technology that we can support to be able to look at how we continue that support at home or in the community. And there were some great examples from Neil earlier about, you know, those things being able to be taken into the home now to continue that rehabilitation. And I think there's some really interesting synergies between keeping people out of care settings when we can, and really empowering people at home. So I think being able to look at that across the, you know, not just the UK, but really push some of our partners globally to be able to say, okay, well, you know, what are you doing to lean in to help solve this problem? You know, you are ultimately the people who are going to benefit through selling headsets and those things. So how do you provide the benefit to us? What can you do and what do you offer? And I think there's some really interesting conversations happening at the moment with some of those really big suppliers.
Thanks, Rod. I think, and this is a question that goes out to the whole of the panel. Some of the questions that we're getting in from the audience is, as an early stage startup or somebody with a great idea, where should people be looking for funding? Is there an assured route, or is that something that needs to be created through this work? Neil, you look like you're keen to answer.
I'll jump in and start anyway. So Ross will know that one of the things that we want to achieve at HEE is to help support a robust innovation pipeline. And there are different groups out in our sort of landscape that are part and parcel of supporting that. Some of this will come via being able to link in with colleagues in things like our academic health science networks, who themselves have innovation accelerators. Also linking in with other communities where we are gradually evolving towards setting up virtual centres of excellence around simulation and immersive technologies and its role within healthcare and education. And a number of colleagues on this group, with Sarah and Ross being at the forefront of this, and Fiona, are keen to look at that. Virtual communities are being set up across the country in general around how we can support the continued innovation around XR. And some of the best innovations will start from very small ideas for people that are entrepreneurial, that don't have access to big R&D budgets. And we want to make sure that we continue involving a system that doesn't allow those to get lost, that we can find ways to facilitate those to be able to be supported, tested, and evolved and developed that may lead to something that's adopted and procured from the system. So there's lots to happen in that space. But Ross, I'd say in the first instance, I'd look to your local academic health science networks, because they've got some excellent resources that people can start to tap into.
Brilliant. Thank you, Neil. Rod, did you want to jump in?
I was just going to totally agree about the AHSN route. I think it's a great route. I think some of the work the AAC are doing to try and connect suppliers and innovators into those arm's length bodies is really good. And I know the innovation service that they'll be launching this summer is going to really focus on that. As I said, what we're trying to do in X is try and draw together some of the funds. So there's a fund prospectus that we're due to publish again, not too distant future, around these are the different funds that are available, and these are the things that you can apply for. But as Neil said, there's the computational power of XR and the reliance on machine learning and AI. There's synergies with some of the awards that already exist. So I think there's some real pockets of excellence that we can actually drive through existing award structures and funding structures. And being able to demonstrate sustainability of these things, I think, is the really important part. But to get some of that seed funding to get it up and running, there's some really interesting things like the National Innovation Accelerators. There's loads and loads of things that are out there across different ALBs to be able to say we're supporting and moving forward with that novel technology. And I think the opportunity, I think, as a consequence of the report, is to be able to say, okay, well, what ones are out there? Let's look at them all. Let's understand which ones we could leverage and understand how we can actually be part of those systems. Yes, let's try and create some new funding streams, because I think it's really important to have that focus. But in the meantime, which ones exist and which ones can we go and encourage people to leverage already?
Brilliant. Thank you, Rod. I'd like to take the opportunity to say thanks to the panel. It's been a really lively and interesting debate this morning. So Rod, Neil, Pael, Ashlyn, thank you very much for being part of it this morning. So it is the time to wrap up. Thank you very much for joining us this morning. I'd like to also give a special mention, as mentioned earlier, to Ben Williams from Care City. Without Ben's kind of initial push, we wouldn't be here at report launch today. And also a special mention to Gabriel Juarez Martinez from KTN, who's also been instrumental in making this happen in the background. Our advisory board and Tom Warner, who is the designer of the website you'll see here, where the report is hosted. So if you can go to xrhealthuk.org, you'll be able to take a look at the report. We don't have it in a PDF downloadable format yet, but press print and it will print out in long form. We hope to get that for you very, very soon. And this is, for us, just the start of this journey. We want to involve everybody here today and further in the UK and globally. So please, please, please sign up to our mailing list. There'll be a variety of events in the near future around making this report a reality, not just a piece of paper. We really actively want to work with all of you to make these changes and to get XR Health into the hands of patients and clinicians in the UK and all across the world. Thank you ever so much for your time, everybody, today. It's been an absolute pleasure.